A new test promises more accuracy in finding prostate cancer. This story and more coming up. This is Path News Network Daily Edition from the College of American Pathologists. I'm Nancy Johnson. It's Monday, December 8th. The FDA has approved a new blood test to more accurately predict a man's risk of developing serious prostate cancer. Called ISO-PSA, the test identifies men age 50 and older with elevated PSA levels who may need a prostate biopsy. The test looks at structural changes in the PSA protein, not just how much of it is present. The new test distinguishes between benign PSA elevations and those attributed to high-grade, clinically significant disease. The CAP's Dr. John Groth is a pathologist at Endeavor Health in Evanston, Illinois. He was diagnosed with prostate cancer last year at age 47.
And so it'd be interesting to kind of know if I had done the ISO-PSA, and it didn't have the appropriate result, would I not have done the biopsy? I don't know. When you look at the algorithm in its intention is to reduce prostate biopsy.
ISO-PSA offers early and accurate risk assessment, helping physicians make more informed biopsy decisions.
But then on the double-edged side is that some of those patients who would have had the biopsies might benefit from knowing that their diagnosis of cancer and then having the other ancillary testing. So I think it'll be interesting to see how all these algorithms pan out.
ISO-PSA is already included in major urology guidelines and is expected to play a growing role in evaluating the likelihood of prostate cancer. And here's another advancement that could prevent unnecessary medical intervention. Johns Hopkins researchers have identified a benign soft tissue tumor with a bony shell that can mimic cancer under the microscope. The findings in the journal Modern Pathology show that the tumor, named OSET, looks malignant on routine tests, but advanced genetic analysis shows it is non-cancerous. Experts say this clearer classification could spare patients from unnecessary chemotherapy or radiation. Amid new federal efforts to tighten visa rules and shorten how long foreign physicians can stay in the U.S., one Chicago pathologist is stepping up to help new pathologists manage the uncertainty. Dr. Neha Varshney is a gastrointestinal pathologist at Northwestern Medicine, and she's hosting a CAP webinar tomorrow to help international medical graduates navigate the system. She came to the United States from India in 2014 on a J-1 visa and will share her personal experiences. A panel of physicians and an attorney will offer their expertise to demystify the process. And finally, a new fundraising effort called Add Your 10 is encouraging pathology residents to make a $10 donation to the CAP Foundation. A donor has pledged to match the first 100 resident gifts, instantly doubling their impact. The campaign is designed to strengthen training programs and support future pathologists, emphasizing that participation matters more than the size of the gift. That's all for today. Be sure to check the show notes for more information on today's stories. Watch your email inbox for more news like this in the CAP's advocacy newsletter every Tuesday and our weekly edition newsletter on Thursdays. We're back tomorrow at 5 a.m. Eastern for another episode of the Daily Edition. I'm Nancy Johnson. Have a great day.